My name is Nicholas White, and I'm going to be talking about wearable data reporting methods, kind of a comparison. Specifically, we're looking at Garmin, and my internship was with RTI International. Uh, Quick overview. So, what was done? I conducted a literature review and a market analysis of consumer wearable uh, devices, and I did a Garmin product test, and I looked at their data reporting methods, and I decided on, or I came across some ideal use cases for those reporting methods, and I'll be describing those here today. And then I'll quickly talk about some of the challenges that were associated with the project, and yeah, and I'll wrap it up from there. So a little bit of background. So my sponsoring organization was RTI International. They are a nonprofit research organization focusing on improving the human condition. And their research areas include health, climate change, water quality, environmental science. They support state, federal government agencies, including and industry partners. And for my project, I was associated with the RTI group developing the WRAP app, or the Wearables Research and Analytics Platform. And I'll get into that in a little bit. But they were associated with the JPEO CBRN group, which is the Joint Program Executive Office for Chemical, Biological, and Radiological and Nuclear Defense. Basically, it's an Army group associated with detecting chemicals in the environment and analyzing and responding to those chemicals, biological, nuclear threats. And so they're really interested in collecting wearable data for research applications. And my mentor was Dr. Robert Furberg, senior clinical informaticist over at RTI. And so the project goal was to support the RAP development team by running a comparison study of Garmin data reporting methods. And so I'll get into that in a little bit. But first, a little bit of market analysis of the consumer wearable space. So the consumer smart wearables market is a growing market, mainly I would say because of our need for data. So the consumer, the company, researchers, we all need data. We have more and more sensors attached to our bodies every single day. They're in our pockets, in our smartphones, they're on our wrists. And I would say this need for data has driven IoT investment, mobile infrastructure investment over the past 10 years. And so what the result is that we have this huge market now. The wearable market's currently valued at 40.65 billion, with a large projected of compounded annual growth rate, 14-19% over the next 4 to 5 years. So obviously it's a very lucrative market. And according to Cisco, there's around 600 million connected devices in 2018 and 1.1 billion projected in 2022. So the point being is that the wearables market, it's large and it presents an opportunity for researchers, companies, and consumers who want to take advantage and leverage the data associated with these consumer wearable devices. All right, and then moving on to the WRAP app, or the Wearables Research Analytics Platform, that's being developed by RTI. So WRAP aims to leverage the benefits of wearables, their affordability, their unobtrusiveness / low profile, their ability to easily distribute and connect these wearables, because they're built for consumers. They're built for people who may not have a technical background. So if you're using them for patients, they're probably good for that. So WRAP really wants to take advantage of the technology that already exists for consumers to further research goals. And some research has already been done using wearables, not exactly with WRAP, but within the healthcare space, there has been research using wearables to monitor vital signs, educate patients on exercise goals, whether they're in the right heart rate range to accomplish their exercise, whether they need to stand up a little bit more. If you guys have an Apple Watch, or excuse me. So if you have an Apple Watch, you know this because you have the the rings they have to fill every single day. And so you get these pushes to finish these rings. And so they've also looked at the behavioral science behind um, behind the quote unquote social network out and the social features behind finishing those benefits behind the the exercise outcomes. Sorry. Okay, moving on. So RTI's platform of choice is the Garmin Fenix 6X Pro Solar. It's the flagship multi-sport smartwatch, and it has a lot of features, including heart rate, respiration, stress monitoring, sleep monitoring, and fitness monitoring. It's RTI's platform of choice, and I was able to use it a little bit in conjunction with this study. And it offers like the most data currently available. I would say it's the highest option, but if you wanted to go lower, you definitely could. Um, so I would say that this is probably the highest range that you could get, but if you wanted to go lower and get less options, then you could. But uh, the methods that I'll talk about are will support those lower end platforms. All right, talk about the methods a little bit. So we have three main methods and then one hybrid method. The first method is the REST Help API, which stands for the Representational State Transfer API. And then the two SDKs or software developer kits. The standard Connect SDK and then the companion Connect SDK. They have different features, and I'll go into those in a little bit. And then there's the hybrid model, which is the API plus the companion SDK. And there's benefits to all of those, and I'll go into those further. But if you look at the flow chart of how the data is transmitted, we can see that there's a split between the user environment and the server environment, um, and how that data flows between your smartphone, your tablet, or PC, between your research server and the cloud or the API system, which is part of Garmin. So what's offered by these uh, data transfer methods? So the data types offered between the three is we have a lot of health data and a lot of fitness data. So, but you can see that there are some gaps. So the health REST API, you have most of your general health data, your steps, your heart rate, your calorie burn, your sleep score, your respiration, stress score, your pulse ox, your body comp. Whereas the standard offers pretty much everything in regards to health and fitness. And the companion offers a little bit of mix of both. So you can see that the health REST API really focuses on health. The standard has pretty much everything, and the companion has some gaps in there as well. But what's really interesting is how that data is characterized. So the three reporting methods, they differ really on how how would you want to integrate them. So your reporting method for your health REST API, it built upon pre-existing JSON HTTP posts. So you could, if you had a pre-existing app that you already had, or want to just do web service pulls, then you could use the health REST API. But if you want to take that extra step and build out a third-party application and build with the SDKs, then you could. But that takes a little bit extra investment. However, if you really want that configurable data logging offered by the SDKs, then you'll need to do that an extra investment. Otherwise, you have to settle for the daily and 15-minute summaries from the API. Also, if you want real-time publication, the Health REST API doesn't offer that, but it does have those 15-minute summaries, which are near real-time. And the if you want that real-time, you have to use the Companion Connect SDK. Also, if you want to avoid reliance on Garmin web server support, then you have to go with this standard. So there's a little bit of mix on what your priorities are, depending upon what reporting method that you'll use. All right, to break them down a little bit more. So the Health REST API, you can see that this is how the data is transferred. You have a sensor in your watch, picks up your heart rate, uses low energy Bluetooth to send that to the proprietary app at Garmin in your smartphone, which is then sending that data to the API with Garmin. Then you can pull that from the API to your third-party server. And you can see that because you involve Garmin in that process, that you don't have a total control over your data. But I would say it's the most accessible of the three options, of the three standard options. And it builds upon that familiar REST API format, and it's good for those prospective large-scale studies that you need that summary data for. The disadvantages, however, I would say is it's highly processed. And so it is that summary data. It's not as niche or nitty gritty as the configurable data logging offered by the SDKs. And it also requires Garmin web server support. So it's less independent, and you don't gain that high fidelity data control with the SDKs. So with the SDKs, you remove Garmin entirely. So you have data reading on the wearable, sends it via low energy Bluetooth to the SDK that you developed with on your smartphone or tablet. And then that data is sent to your third-party server or your research searcher for your research use. So you can see there's less interference by Garmin, less processing by Garmin. And so you get that raw data pretty much straight out of the wearable, which is a pro and a con. So for the standard, the advantages are that you get complete control over that data, you get a wide range of data types, fitness and health, and you have that configurable data logging offered by the SDK. Disadvantages is that you don't have access to that real-time data streaming, and you do have to build out this third-party app that you require some investment. And then for the companion, you do have access to that real-time data stream, which is nice, and you have configurable data logging, but you might need Garmin for some aspects since it's a companion SDK, so it relies on Garmin somewhat. And you have limited data types, so you don't get that sleep data, you don't get some of that fitness data, and it requires that SDK implementation as well. And so for the hybrid model, which is really interesting, this is suggested by Garmin, use of the companion SDK in conjunction with the REST API, whether you're pulling data in series like this or in parallel, you get a combination of both, which is nice. And so the result is you get advantages of the historic summaries from the Health REST API, access to the real-time data streaming from the Connect SDK or the Companion Connect SDK, configurable data logging from the Companion SDK, and you get pretty much all health data types. You don't get access to the fitness data types offered by the standard, and you still have to build out a third-party application for use of the Companion SDK, but I would say you get the most robust data available for Garmin. So in conclusion, depending upon what your prospective use is and what data you're interested, companies or research teams have some options that may be better than others. So I would say that the most accessible option was the Health REST API that I looked at because it builds upon that familiar REST API infrastructure. But if you want to take that time to invest into a third-party application and you're concerned about security or you want more adaptability, then you can go ahead and go with the standard Connect SDK and remove Garmin entirely, or use a hybrid model of the Companion Connect SDK and the Health REST API to support. So obviously, I liked working with RTI. I liked meeting the people that over at RTI, but there were some challenges. I would say that like the two other presenters today, the remote work was challenging. Um, Gaining remote access via my personal computer required extra hoops to jump through, VPN use, remote access, digipaths authorization. That was continually challenges faced every day. And there were a lot of communication difficulties with the RTI team as there was limited time for meetings and email feedback. And also, I would say that there was some project pivots during my time, and my project started large and then continually narrowed scope as the internship progressed. So, yeah, I wouldn't say that it's like without challenge, but it was challenging.